Let's go ahead and get started. It looks like everyone who was in the waiting room has been admitted. Welcome everyone to this discussion about the Medicare Advantage Plus Plan. Thanks for being here. I'm James Davis, president of PSC, and obviously we know that retiree healthcare is very, very important to all of our members, but especially to current retirees. And so we appreciate everybody making the time to come and speak with and hear from representatives from Emblem and Empire that are going to be offering the Medicare Advantage program to municipal retirees. I'm going to let the representatives from the alliance that's administering the program introduce themselves, and they're going to share a brief presentation with us, and then we're going to go to questions that you all have. There are a number, several hundred people on the meeting today, and so in order to try to accommodate questions that everyone has, we're going to do a few different things. One is, first of all, the retirees chapter sent ahead in advance a series of very good questions that they wanted to make sure that representatives from the alliance could respond to. And so that will be front loaded as part of the presentation and the initial round of questions that alliance reps will respond to. And then we'll also ask people to raise their Zoom hands, and the representatives will hear questions then as well. But what we'll also be doing is dropping a link into the chat for people to submit questions that can't be answered, or that they don't have time to answer during today's session, so that we can follow up and that representatives from the alliance can follow up and respond to your questions. The other thing that we'll put in the chat, in addition to the link for submitting questions, is that there is an 800 number that's live and currently available to field questions as well about the Medicare Advantage plan. And there is also an FAQ page on the Office of Labor Relations site. And so there's a lot of different ways to get support for the questions about timing and transition, and specific questions about your individual medical situation. So I know that our alliance partners are really eager to speak with you about the plan that they have put in place. If you're currently putting questions in the chat, I would just ask you to be sure to raise your Zoom hand when we get to that segment of the meeting, and ask those questions to the alliance representatives. If you're not able to get the questions answered within the time frame that we have today, again, there will be a web form that you can submit the questions to. So rest assured that your questions will be answered. After, when we get to the 3 o'clock hour, or shortly thereafter, we're going to transition to a different segment of the meeting where the representatives from the alliance will leave the meeting, but folks from PSC will be asked to stick around if you'd like, and we can have a debrief among ourselves and follow up among ourselves as well. So, okay, so thank you again, folks, for being here and for your patience in the waiting room. Apologize for keeping you waiting, but let's go ahead and let me ask the representatives from Emblem and Empire who are here with us today to introduce themselves, and they'll also want to share their screens. So please go ahead, and I don't know if that's Kim or Marlon, I think you're going to kick it off, right? So go ahead.
Well, welcome everybody. Thank you so much for joining. We really appreciate the opportunity and this long partnership that we've had over the years. Kim Parker is going to present and give you a high-level overview of the new New York City Medicare Advantage Plus program that is going to be effective 1/1/2022. I'll segue to Kim Parker. Oh, by the way, I'm one of the account managers that is going to be, helping in regards to administrating the program. Kim? Kim, I think you're on mute. There.
I couldn't get off mute. Sorry about that. Hello, everyone. I'm Kip Parker from Empire, and I will be the account executive responsible for overseeing the new Medicare Advantage program that the city of New York is offering to their retirees. I will be going over a brief presentation to address how the program works and a couple of components. And the PSC union did send me some advanced questions. So I'm going to try to address all of those questions during the presentation and then do a summary at the end. And then obviously open up enough time to field some additional questions. James, I don't know if you wanted the other team members from the Alliance to introduce themselves or just jump right into the presentation.
I'm going to recommend that. This is Chris. And again, the other people on the phone would be Kathy Smith McElhenney and also Gary Scamardo, who's on the phone from Emblem. And I have Chris, I have oversight for the entire city for both the Alliance and Empire BlueCross. So I'd rather get right into the presentation for this. And then obviously the questions and answers, let's go forward so we can use our time wisely. Thank you.
Thanks, Chris. Okay, can everyone see the screens? Okay, perfect. Thanks, Marlon. Okay, you can move to the next slide. Okay. The ultimate goal from today's presentation is to really address a lot of the questions that have been coming out during the pre-award and a lot of the misinformation or apprehension that some of the retirees have in regards to what this actually means and how the program works. So I'm going to go through an overview of how Medicare Advantage in general works, specifically the Medicare Advantage New York City, the Plus program. I'm going to spend quite a bit of time talking about the national provider access and how you can utilize any Medicare participating provider. I'll review through the enhancements of the program. I'll highlight a high-level benefit comparison and then also address all of the member questions and answers that come in. So Marlon, you can move right on. Now this slide actually gives an overview of how Medicare Advantage works. Basically, Medicare Advantage is a program that combines all of the pieces of Medicare together into one program. So on the left-hand side of the screen, you can see what you have current state today, which is traditional Medicare and your secondary senior care program. So the way it works today is Medicare is divided into two parts. Part A, which is your hospital benefit. Part B, which is your medical or your professional doctor benefit. And then you have the senior care Medicare supplement program that wraps around Medicare and pays secondary. So it picks up what Medicare doesn't cover. Under a Medicare Advantage program, the New York City Medicare Advantage Plus Plan, we're rolling those three parts together. So we become the administrator of your Medicare Part A and Part B benefits. And then we also fill in the gaps of what Medicare doesn't cover. So we're rolling everything into one program. We're simplifying the experience because you're having one single ID card. Today, you have 3 ID cards for your medical plan. You have your Medicare card, you have your Empire card for hospital benefits, and then you have your Emblem card for your GHI card for your medical benefits. Everything will be combined into one ID card. And we're also combining all of your explanation of benefits into one EOB. So you're no longer going to get an EOB for Medicare and then an EOB from Empire for hospital services and one from GHI for medical services. So it simplifies everything into one program. Now, I do want to emphasize the fact that we are contracted with the federal government to administer Medicare benefits. And what that means is we have to cover everything that traditional Medicare covers today. So if it's a service that traditional Medicare covers, we're required, based on our contract with Medicare, to cover those services. We follow the same guidelines and the same medical necessity requirements that traditional Medicare has in place to determine medical necessity. So the same guidelines are followed under the Medicare Advantage program. Now, in addition to simplifying the process with one ID card and one set of explanation of benefits, there's a whole host of additional enhancements that come with the program that you do not have under traditional Medicare or the senior care plan today. I always like to refer to the New York City Medicare Advantage Plus Plan as a healthcare delivery system rather than simply a payer of claims. So Marlene, you can move on to the next slide. This is probably the most important question, or it's the first question that's asked by retirees all the time, and that is, can I continue to see the same doctors I'm seeing today? And the answer is yes. The only restriction is they obviously have to be a Medicare participating provider. And currently today, there are approximately 850,000 providers nationally that participate with Medicare. So you will have access to all 850,000 providers. But a subset of those 850,000 providers are the providers that are contracted within the Alliance network. So they are either an Empire, or a BlueCross BlueShield participating provider. There's over 640,000 of those providers that are nationwide within our network. And I do want to emphasize specifically in New York, all of the New York hospitals and hospital systems, except the New York City Medicare Advantage Plus program, and that includes Memorial Sloan Kettering and Hospital for Special Surgery, as well as many of the national centers of excellence across the country that currently work with us today and see members. Johns Hopkins, UMass, Mayo Clinic, just to name a few, that currently work with us and accept the program and treat members that are in our Medicare Advantage programs. Thank you. In addition to, I mentioned earlier on the very first slide some of the enhancements, and I wanted to call out specifically a few of these. Obviously, one of the first ones that comes up is Silver Sneakers. It's your free gym membership. It seems to get the most, attention. We also have non-emergency transportation, and this is something new. You'll now have 24 one-way trips to and from the doctor's office, hospital, or pharmacy. So you will now have a transportation benefit included. We do have the telehealth, Live Health Online benefit, which is virtual doctor visits, and you'll be able to access medical visits virtually right over your computer, iPad, or smartphone, and that's a zero copay for all telehealth services. Healthy meals is something that's new that traditional Medicare and senior care do not cover today. And the Healthy Meals it's designated for post-discharge most of the time. So when you are discharged from the hospital, you could be eligible for up to 56 meals per year delivered to your home. But you could also qualify for the Healthy Meal program if your body mass index is above or below a certain index number, or if your A1C numbers are elevated and you need to have meals delivered to help control your diabetes. Flipping to the Healthy Pantry benefit, which is similar but not the same. The Healthy Pantry benefit is developed for members who have certain chronic conditions to help them manage that condition with nutritional and dietary changes. So members that qualify for the Healthy Pantry benefit, I always use diabetics as a good example, but then there's also cardiac patients, heart patients that have hypertension that could qualify as well. A member would get a shelf-stable pantry box delivered to their home each month with a variety of items, as well as a monthly nutritional counseling session with a nutritionist to help keep the member on track in regard to some of the dietary changes. There's a wellness rewards benefit. Members can earn up to $200 in wellness gift cards for completing certain preventive care screening tasks, like going for your annual physical, having your colonoscopy or your mammography done. So every time you do a preventive screening or a wellness activity, you could qualify for a reward. We also have the 24/7 nurse line benefit, which is a nurse that's available 24 hours a day, 7 days a week, to really help you triage your condition. So it could be something that happens in the middle of the night and you're not sure if you should go to the emergency room, or if it's something that can wait until the morning to see your regular family physician. So it's really your opportunity to bounce off a medical professional to help triage your decision in regards to what level of care you should seek. You also have urgent and emergency care worldwide while you're traveling. So whether, no matter where you are in the world, if you have an urgent care or an emergency situation, those benefits will be covered worldwide. There's also our concierge health guide. This is, I like to call it the customer service or member support line on steroids. And this is going to be your customer service member support line after January 1st. So once the plan goes into effect, and these member service representatives are there not just to simply quote benefits and look up claims and resolve simple issues, but they're also there to hold your hand, to help you navigate the health plan and to be able to access all of the various great benefits that are included in the program. So they may get on the phone and help schedule a doctor's appointment for you. They may coordinate and get you hooked up with one of the care management or case management nurses, or they might help you initiate some of the benefits like the healthy meals or the healthy pantry benefit. So they're there to really help you access your plan and get the most out of your program. We also have, I'm just having a tough time seeing the bottom, but I know what the icons need. There's also the health and fitness tracker. So basically all members will qualify for a Fitbit, and that's every 2 years. And in addition to the Fitbit for physical activity, there's also a cognitive activity tracker that is linked to the health and fitness tracker as well. So these are just some of the additional enhancements that come with the program. I did want to go over some of the, I guess, next steps, just to let everyone know what's going to happen before I go into the plan comparison. As of right now, the City of New York has posted on the Office of Labor Relations site their FAQ document, which James had mentioned earlier, but they've also posted a plan comparison document that outlines the current senior care benefits today for 2021, the senior care benefit plan package for 22 compared to the New York City Medicare Advantage Plus program. So you can see a clear picture of how senior care in 22 is going to compare to the New York City Medicare Advantage Plus program. So that's really the first step of the communication campaign, was to get those FAQs out on the city's website so that we have something that members can react to and see right away. The next phase of the communication plan is you'll be receiving a letter from the City of New York that is an announcement letter that's really talking about that change. In that letter, we'll also have a hard copy of the FAQs as well as a copy of the plan comparison guide. Then that will be followed by a more comprehensive member enrollment, pre-enrollment package that will come from the Alliance. And in that enrollment or pre-enrollment enrollment package, it's going to have all of the information that describes this plan in great detail. So you're going to have all of your online resources outlined, phone numbers outlined in the document, a full summary of the current benefits, as well as all of the resources associated. So these are the steps that are going to be taking place. And all of this is going to occur through the month of August. So members get their materials in the month of September. So that's the timing for the rollout. Marlon, if you just want to move to the next slide, I'll give a high-level overview of how the New York City Medicare Advantage Plus program compares to the 2022 senior care plan. So the annual deductible is going to stay the same between the two plans. So it's the $253 total deductible that you would be responsible for under the Medicare Advantage Plus program. The annual out-of-pocket maximum, this is something that's new under the New York City Medicare Advantage Plus plan. There will be a $1,470 maximum out-of-pocket. And how that is reached is all of the copays that you would be paying for services. So every time you pay a $15 copayment to a specialist, or if you go into the hospital and you pay a $300 hospital admission, all of those copays count towards that $1,470. So you have a catastrophic cap in place. So once you reach that, there will be no more copayments or out-of-pocket expenses associated with the medical plan that the member would have to pay. Under the current senior care program, there is no catastrophic cap. Your cost shares could just go on. So it's an unlimited cap. So we have a catastrophic threshold that's put in place. For your inpatient hospital care, it's staying the same. It's a $300 copayment per admission with a $750 per person maximum per calendar year. So if you go into the hospital for 3 hospital admissions in 1 year, the most you would pay would be the $750. Your skilled nursing care benefit follows the Medicare benefit period of 100 days, and it will be the 0 copay for days 1 through 100, same as it is coordinated under the senior care program today. Your PCP copay is going to be 0 under the New York City Medicare Advantage Plus program, whereas the senior care program is changing in 2022. So you will now have a $15 copayment for both primary doctor visits as well as specialty care under the senior care program. The Medicare Advantage Plus program will have a $15 specialist copayment. One of the questions came in is, how many copayments will I pay in 1 day? Is there a cap on copayments for services? You would be responsible for a copayment for every provider visit you have. So if you go to a provider and they do multiple things within one visit, you would be responsible for the 1 copayment under the Medicare Advantage program. But if you're going to multiple doctors or multiple different providers in the same day, you would be responsible for that copayment for each separate provider visit that you have. Under the emergency room copayment, it's the same as the senior care program. It would be a $50 copayment for emergency room services. And if you're admitted into the hospital, that copayment would be waived. So you would not pay a $50 copayment in addition to an inpatient hospital copayment. And I did want to call out dialysis is one of the more commonly asked about benefits. It is a 0 copayment for outpatient dialysis treatments. I do want to go through some of the pre-submitted questions that the Welfare Fund had sent over so that we can, and I can't seem to get to them. Okay, thank you, Marlon. Okay. All right, so we talked about, they want to be specific in regards to deductible changes, copay, coinsurance. I want to refer everyone to the Office of Labor Relations website where the plan comparison document is loaded on their website. It's a more comprehensive comparison of what the 2022 senior care benefits are going to look like compared to the Medicare Advantage program. So for the most part, all of the plan changes that are going into effect for the senior care plan for 2022 are the similar benefits under the Medicare Advantage program, with the exception of that PCP copayment, which is going to be a 0 copay under the Medicare Advantage program, but the $15 copayment under the senior care program. The question came about will you be charged a physician or a provider copay while you're in the hospital or while you're in a skilled nursing facility every time a doctor comes in to see you or to treat you in the facility? Your provider visits are included in your facility copayment. So when you're in the hospital for an inpatient hospital admission, it would be that $300 copayment per admission. That includes all of the doctors that see you while you're in the hospital. So if you have to have physical therapy and occupational therapy or other doctor visits, when you're in the hospital, that's included in that initial copayment. The same would apply for the skilled nursing facility. So all of the physicians that see you while you're in a skilled nursing facility would be included in that skilled nursing facility benefit. In what circumstances will I need to obtain a referral to see a specialist? The program is a non-gatekeeper program. It's a passive PPO, which means that you do not need to get a referral from your primary care doctor to see your specialist. So it's open access. You can go see your specialist whenever you want to see your specialist. In some circumstances, there could be certain types of services that might require prior authorization. And some examples of those services are planned hospital admissions and surgeries, your complex diagnostic tests and radiology services. So for example, CAT scans, PET scans, MRIs, those types of procedures we would be looking for prior authorization. Now, I do want to emphasize the fact that the prior authorization process is handled by the doctors. So it is not the member's responsibility. The doctors handle all of that, and it's behind the scenes. And the providers know what services need to be prior authorized before you have the service done. So they will handle all of that for you. Our program, we follow the same Medicare medical necessity guidelines. So if it's covered under Medicare and the criteria is met under Medicare, the same criteria is going to be used under the Medicare Advantage program. Okay, I talked about what hospitals in the New York City area accept the Medicare Advantage Plus program, and all of the hospitals within New York City will accept the New York City Medicare Advantage Plus program. A question came up about other centers of excellence throughout the country. I mentioned a few. Many of them we work with on a regular basis. So you'll be able to continue to see, utilize Johns Hopkins and Mayo and UMass, just to name a few. Is there a number or frequency for the amount of therapy sessions for PT, OT, speech therapy? Are there caps? There are no caps or visit limitations. What will happen with those therapies is the doctor will put in a treatment plan and request that they want to have you go for so many visits of therapy. And then they will be reevaluated once you go through those initial visits. And if they need to extend for more visits, then the extension would be made and the doctor would be able to continue with additional visits. So there's no set hard cap. It's based on medical necessity, and it's based on your doctor's recommendations in regards to the continuation of a treatment plan. Okay, so I think I addressed most, although I do want to touch upon a couple of two or three more items. One question that has come up quite often is, will I continue to receive my Medicare Part B reimbursement from the City of New York? And the answer to that is yes. And that will also include your income-related excess reimbursement as well. So as long as you participate in a City of New York medical benefit option, you will receive your Medicare Part B reimbursement. In regards to the costs of the program, the New York City Medicare Advantage Plus program is now going to be the benchmark program that the City of New York is offering. And you have the opportunity to not choose to go into the Medicare Advantage Plus program if you don't want to. You can opt out and stay on the current plan that you're in today. If you choose to do so, you will be responsible for the premium difference between the new benchmark program, which is the Medicare Advantage Plus plan, and the cost of your current program. And the city is working and finalizing those premiums right now. But if you do choose to stay in your current plan, you would be responsible for the premium difference between the Medicare Advantage plan and the cost of your current plan. And the Medicare Advantage program, the benchmark price that the City of New York is paying for the program is $7.50. So anything above that premium would be the responsibility of the retiree. Okay, I think I answered most of the pre-submitted questions. I will now, James, I'll turn it over to you if you want to
Great.
start opening it up for a couple of questions from the audience.
Let's
So
see how
James,
many.
before you open up, I saw some of the chat. I think I want to just address some of the comments that are there.
Okay,
So that folks understand that this plan is a custom plan that we're able to do on a group chassis, the way that the RFP came in. So we were designed this specifically only for the New York City retirees. In addition to that, just understand that this is not like your individual Medicare Advantage plan that a lot of folks hear about, where there's limited access to doctors, where there's referrals that you need. This plan doesn't have that. This plan has no referrals, and it's on what we call PPO network, which allows you to see or have access to any of the Medicare providers. In addition, I saw something about profits. Through the Medicare CMS program, whatever gains the plan makes needs to be reimbursed. Reinvested into the infrastructure of the Medicare program. What does that mean? Anything that when it comes to like either digital components, whether it comes to case management, clinical programs, customer service, so on and so forth, that needs to be reinvested into the plan. And finally, I want folks to know that Medicare, this type of Medicare Advantage plan follows a STARS program. So it's kind of our report card. And we have to make sure that we actually perform well, customer service, our networks, our claims, so on and so forth. So overall, we have a strict regulation through CMS, really oversight on what we're doing in order to make sure that we're performing well. So it's a huge investment on our end to make sure and that we continue to have our members be happy. So I'll stop there. I know I just saw a couple of chats and I just wanted to make sure that I address folks. We've had a long relationship with the city and we want to continue servicing in that perspective. So I want to debunk some of these myths sometimes that surround the Medicare Advantage.
Marlon, thank you. Kim, thanks for your presentation as well. And Janet Kwan has just placed in the chat instructions if you don't know how to raise your hand for how to do that for your Zoom hand. I'm going to try to call on 3 people at a time, and if they could be unmuted to ask their questions, and we'll get through as many as we can. Folks, there are lots and lots of questions as well. There should be, and if I could just ask the people who are asking a question to try to confine your remarks to a minute or less, that will make sure that the greatest number of people get their questions asked and answered. And you'll also have an opportunity to submit any questions through a web form that you don't get to ask today. So thanks for your patience. Michael Engber, and then we'll go to Charles Shorts and Denise Rickles. Please, Michael.
Hi, am I unmuted?
You are.
Okay, my doctor, my PCP, is non-participating in Medicare. There seem to be 2 kinds of non-participating. What my doctor does is he charges me 15% more than what Medicare permits. I pay him that 15% more. Medicare reimburses me according to its schedule, and then senior care, the other 20%. I'm 15% in the hole. My wife has a doctor who wants nothing to do with Medicare. He won't take a nickel. He won't file a form. She pays him what he wants, which has nothing to do with what Medicare allows. So when you folks say any doctor who participates in Medicare is included, what about my PCP? Clearly not my wife's doctor. I understand that. But what about my PCP?
Okay, this is actually a great question, and it gives me an opportunity to address this probably for a lot of individuals that are in a similar situation. There are I look at it as there's 3 different levels of Medicare participating providers. Your first level is a doctor who participates in Medicare and accepts assignment. And your next level is a doctor who participates with Medicare but does not accept assignment. And then the third is a doctor who's opted out of Medicare altogether. So in the situation of a Medicare provider who participates but does not accept assignment and can charge that additional 15%, that is covered under the Medicare Advantage program. So you can continue to see more doctors on an out-of-network basis, and then we would cover that provider for the full 115% of Medicare allowable. So your provider could bill us as they bill Medicare today, and we would cover that full 115%.
Let's say 3 questions.
Thanks, Kim. And folks, if you're not speaking, please stay on mute. Kim, I'm going to ask the next couple of folks to ask their questions in sequence, and that way you can try to synthesize them and possibly move through a little more quickly that way. So Charles Schwartz, please, and then we'll go to Denise.
Good afternoon, everybody. 3 questions. If the retiree member predeceases the member's dependent and the retiree has traditional Medicare and senior care, can the dependent stay on senior care since it is being paid for, self-paid senior care? Retiree dies, can the dependent stay on?
Thanks, Charles. I'm going to just take one more and then we'll go to the responses.
Okay.
Denise Rickles, please.
Okay, so this new plan will supersede senior care as we use it now. So what is the Senior Care 2022? Doesn't make any sense. And it seems to be almost the same as the new plan. And the choice to opt out is not there, where you want to maintain your Medicare, traditional Medicare. So again, why do you have a senior care? It's really confusing. You have one senior care as of 2022. It's so confusing. Thank you.
Let's go ahead, Kim and Marlon, and if you can respond to those 2 questions, and then we'll take some more.
Sure, great. In regards to dependent coverage, if a retiree is to predecease their dependents, they can stay on the current program and continue to pay 100% of the premium. So the same process that's in place today, the dependents would continue on the plan and pay the full premium for the program. I did want to address quickly for dependents that are under 65, their coverage would continue on the current program that they're in today under the GHI CBP plan. So for under 65 dependents, their coverage would remain the same under that program. In regards to the senior care, the benefit comparison, the City of New York and the MLC wanted to have a comprehensive snapshot of the differences in the plan because the senior care plan is changing regardless of the introduction of the new Medicare Advantage Plus program. The benefits for senior care were changing for 2022. So the city and the MLC wanted to present a full picture of what the benefits look like today in 2021, what they're changing to in 2022, as well as comparing that to the new Medicare Advantage Plus program for 22. I hope that answered your question.
Thank you. Let's go to questions now from Susan Foreman and Howard Thames. Susan?
Thank you. Just quickly, could you please repost the first slide you put up? I'd like to get a photograph of it.
Susan, we can actually share the presentation with the union and they can share it with you. So we'll be more than happy to share this with you.
I'm having dinner with a friend tonight who is concerned about this. I'd like to be able to show him a picture of that slide.
Okay, Sure, but at the end of the presentation, at the end, we'll pull it up so that you can take a picture of it. You want the comparison, the Medicare Advantage overview?
I got the other two. I just missed the first one. I wasn't quick enough on my phone.
Okay.
Thank you.
Thanks, Susan. Howard? Howard, it doesn't look like you're muted, but I don't think we can hear you. Okay, Howard, we still can't hear you, even though it seems like you're unmuted. Can we come back to Howard? Let's go to Nancy Romer and then John Hyland. Nancy?
Okay, thank you. So in the thank you all for the presentations, and I particularly want to thank Bill Friedheim, who is the chair of the retirees chapter, who's really led this effort to call for a moratorium, and for James Davis, who has valiantly advanced this in the MLC. And this is exactly, we have a lot of questions, and that's why we were hoping for a moratorium, but this is where we are now. In one of the memos that the MLC sent out, they said that that negotiations with Memorial Sloan Kettering and the Hospital for Special Surgery would be completed by the end of December. To me, that means that they're not completed, and that those two hospitals, which are among the best in the world, and many of us rely on them, have not signed on the dotted line. So I'd like you to respond to that. I'd also like you to respond to the question of future contracts. This contract sounds pretty good. One of the concerns that has been raised by people who have Medicare Advantage elsewhere is that the first contract is good. The second contract 5 years later, not so good, and down the line. And then the final question is, if we choose to opt out of this and go with our old coverage, can we ultimately join back in to Medicare Advantage? Thank you.
Okay, so let's go ahead and give you a crack at those, because those are three questions that may be on the minds of several of our retirees. Thank you. Go ahead, please.
Absolutely. Thank you, Nancy, for the questions. I'll start off first and foremost with the Memorial Sloan Kettering and Hospital for Special Surgery. Those two hospitals do not have a in-network signed contract with us today. That's what we are working on. However, both of those hospitals do have an agreement with us today that they see members on an out-of-network basis. So they are currently providing care to existing Medicare Advantage members in New York under our programs today. So that we have a commitment from both of those facilities in writing that they'll continue to see their members. What we're trying to do is to get them into the network and actually have a contract with them that will help us be able to coordinate care better on an in-network basis. So it's really from a coordination of care basis to be able to get those providers in network. But currently today, they are seeing Medicare Advantage members, and we have a commitment from both of those hospitals that they will continue to do so. In regards to, I have the contract question. I think I may have forgot the middle question. Okay, now I remember. So the contract question. This contract is a 5-year contract that was part of the negotiated acquisition process. And after the 5 years are up, the city has the opportunity to renegotiate with the Alliance for 1-year extensions after that. So as of right now, you will have the contract's good for a full 5 years, and then we would renegotiate. And obviously, if the renegotiations were not going in the favor of the MLC and the city and the retirees that they represent, then they would probably, look to modify that. In regards to opting out and then coming back into the program, the city has stated that they will allow the retiree transfer period to be on an annual basis now. So if you choose to not enroll in the Medicare Advantage Plus Plan today and stay on your senior care and then want to join the Medicare Advantage program next year, you could do so. So retirees will be given the opportunity on an annual basis to change plans.
In addition to the actual current policies that they have as well, you have that one time lifetime change that you can always utilize to get back into the program. So that's currently in place, and that's going to remain in place, from my understanding.
Thank you. Let's, John Hyland, before we go to you, I want to just circle back and see if we have any better audio from Howard, who we tried to hear from before. And if not, we'll go to John. Howard, are you there? Okay, sorry about that, Howard. I'm still not hearing you. John Hyland and then Linda Sharib.
Okay, my question is there any limit to the number of times you can opt in or out from one plan to the other?
The city of New York is going to allow members to make a change during an annual fall transfer period. So for this coming process, you have the ability to opt out and stay on your current program if you choose to. And then next year, you would have the ability to make a plan change. So you can change programs on an annual basis.
Okay, and with that is, if one, for example, opts out and then comes back in again, is there any disqualification or problem with any pre-existing conditions that arose in the meantime?
No, you would be staying on a consistent benefit program, so you would not have to worry about pre-existing conditions. You're going from one city of New York health plan option to another health plan option, so you would not have to worry about any pre-existing condition limitations.
Thank you.
Thanks, Kim. Let's see if we can take a few in a row and try to synthesize them. So first, Linda, and then
Yes.
Can we go to Jared Rifkin and then Joel Berger?
Hi, good afternoon. I have two questions. We are no longer living in New York. We're living in the state of Connecticut. Will Yale New Haven accept the new plan? And how do we find out which hospitals and which doctors will be accepting the plan that is based for New York City?
Okay, thanks, Linda. Let me before Kim and Marlon answer
Thank you,
that, let's
James.
just get some more in. Thanks. Jared, please. Jared Rifkin.
Yes, two questions. The first one, I'm a little confused in the stuff that we get from from UFT, which my wife is a member, and other stuff. The question of long-term hospitalization, whether is hospitalization coverage limited to 100 days, or is it for the full year? My concern is whether I should continue with my major medical insurance coverage.
Okay, thank you, Jared. I know they look like they want to respond to that, but let me try to squeeze in one more from Joel Berger. Please, Joel.
Yes, thank you. In this program, the Medicare Advantage Plus, is it required that every participant have a primary care physician? Or can you not have one and just see specialists?
Okay.
Okay,
Thanks.
James, I'll take a stab at responding in the reverse order. Regarding a primary care physician, you are not required to have a primary care doctor. You can just go see specialists, so you do not have to have a PCP. Regards to the hospital benefit, the Medicare Advantage Plus program covers hospitalization for 365 days out of the year. So that's your inpatient hospital benefit. So there's no need for any extended, hospital rider. If you're referring to a skilled nursing or long-term care benefit, that would be something separate. So you would probably want to look to evaluate to continue that benefit if it was for the long-term care coverage for custodial that's not covered under Medicare or any of the health plans. The question that came up in regards to Yale New Haven in Connecticut, yes, Yale New Haven is a participating hospital within our network. And I want to emphasize to everyone that all providers within the Blue Cross Blue Shield National Medicare PPO network are in network. So you have participating providers, not just in New York, but you have Blue Cross Blue Shield providers throughout the country, and US territories. And I encourage everyone to call the call center support line, which is the 1-833-325-1190 phone number. Have the representatives look your doctors up in the system. Currently today, most New York City retirees are seeing an in-network provider that's contracted in our network today. Over 90% of utilized providers are in-network providers. So you can either call the phone number or you can go on to empireblue.com and do an online provider search to confirm if your doctors are in the plan or not.
Great, thanks, Kim. And I know there are many more hands up than we'll be able to get to. Let's do some more, but let me remind folks who have their hands raised that we will place a web form URL into the chat. I think our executive director, Dean Hubbard, has been pasting that into the chat, so he'll continue to do that. And if you don't get your questions answered here and now, that way we can follow up with Alliance representatives after the meeting. Let's try for a few more though with the time that we have. Marjorie Stamberg, Bonnie Nelson, and Susan Newman, please.
Thank you. It's Marjorie. I am still confused about the question of prior authorization, because you have stated that the doctor will have to get that first. It's in his hands. But right now, if my doctor says I need a DEXA scan or an MRI, whatever, I just call up and get it. It doesn't require anybody, to my knowledge, to prior approve that. So could you please, and another person on the chat has asked, is there a list of what procedures will need prior authorization, and how long would it take to get those? Thank you.
Thanks, Marjorie. And before you guys, let's see if we can squeeze in a couple more. Bonnie and then Susan Newman, please.
Yes, Mike, can you hear me?
Mm-hmm.
Okay, my question is, what happens if I go to my doctor and he says, I will not take this plan, I will not participate, and I still want to see him, and he charges me his full retail price, which is 6 times what Medicare allows. Do you reimburse me for the amount that I have to pay?
Bonnie, thank you. And Susan, and then we'll let Kim follow up.
All of my physicians but one are affiliated with New York Presbyterian, which I recall that one of our representatives was not happy about at one point. But if New York Presbyterian is, that's fine. But none of the doctors none of the Columbia doctors, and I went through all of them, none of them accept a Medicare Advantage plan. Yet a couple do seem to take $11.99. Will you be speaking to all these Columbia doctors that don't do it?
Okay.
Okay, I'm going to go in reverse order. One of the initial tasks that we're doing is provider outreach to every single provider that City of New York retirees are utilizing. And we're going to mainly focus in on those out-of-network providers that are not contracted with us today, to educate them on the program and do outreach so that members can continue to receive care without any stumbling blocks. So those providers can bill the plan directly. So you can continue to see those doctors affiliated with Columbia that are out of network. Your cost share would still be the same. So you would just pay your $15 copayment, and those providers would bill the New York City Medicare Advantage Plus Plan. We will reimburse those providers the same Medicare allowable rate that they receive through traditional Medicare today. So that's how we would reimburse those providers. The New York Presbyterian providers, many of them are in the network, so that should be a non-issue. But we are doing outreach to both out-of-network as well as in-network providers. If there's a situation, now this will go back to one of the, I think Bonnie's question, we are going to do the outreach campaign. Now, if you or any member has a situation where they go to their doctor's office and they say, I don't want to take the plan, I want nothing to do with this whatsoever, we want to outreach to that doctor, because 9 times out of 10, it's really a simple education process so that they understand that they're not getting paid less from the Medicare Advantage program, that we reimburse the provider the same as traditional Medicare does today. Usually that is, it resolves the issue and we take the member out of the middle. So I ask any member that runs into a situation, to contact the concierge phone number. We will do outreach to that provider. Worst case scenario, at the end of the day, if after all of the outreach and the phone calls that we do, they still say no, we will reimburse you. So you would pay for the service. Doctors are not allowed to charge any retail price they want. They have to follow the Medicare billing laws. So the most a provider can charge for a service is 115% of the Medicare allowable rate. And we would reimburse you the maximum Medicare billing amount of the 115%. So we would prefer that that doesn't happen, but worst case scenario, we would reimburse you for those services. Prior authorization. The prior authorization process is handled between the provider and the plan. So the member is not responsible for coordinating any of this. The doctors do that. So in the example of needing an MRI, what would happen is the provider that's performing the MRI would coordinate with the doctor ordering the MRI to have the prior authorization completed with the plan. Typically, prior authorizations, depending on the type of service or the urgency of the service, could be processed anywhere in 3 to 7 days is what the average processing time, similar to the wait time that you would have in scheduling an appointment. So that's how the prior authorization process works.
I do want to call out also, if there's an emergency, there's no prior authorization. And then two, they fall into different buckets. If it's urgent, the provider that's contracted with us will submit that this is urgent, and typically that turnaround is between 24 to 48 hours. And then the standard in regards to the way CMS does from a retrospective perspective could take up to 14 days, but our average time is way below anything, So there's two ways of looking at this. There's Medicare Advantage does more of a prospective approach to this, so there's no surprises on any of the services that the members get. And then CMS also does prior authorization, but they do on the retrospective perspective. I hopefully that makes sense. And Kim, if you want to add to it, please do.
Nope, all good.
Kim and Marlon, we've kept you a little bit over time, but if you're willing to stick around, could we do 2 more questions before we kick you out? Great.
Sure.
You can do 3 or 4 if you would like.
Okay, terrific. All right, great. Let's try. And again, apologies to folks who aren't getting to vocalize their question, but you'll have a chance to ask it. Let's go with Arlene and then Sandra. Sorry, I lost the thread here. Arlene and then Sandra,
Yes.
and then Mahala, please.
Yes, here's my question. The reason the plan was changed that we received was that the city wanted to save money. I am confused. How does the city save money and then provide a plan that seems to be better than we had? That is a question I'd like answered. Saving money generally doesn't give you something that's better. Can you please resolve that for me and for the other participants? Thank you.
Thank you so much, Arlene. Let's go to Sandra's question and then Mahala, and we can try to take them in one fell swoop. Thank you. Sandra?
Yeah, I'm very concerned about this opting in and opting out that's been set up where you are opting us into Medicare Advantage, although we don't want to be in it. And so I have to opt out to get to what I am legally entitled to. What's the legal basis for you doing that? It's very troubling to many people that I know.
Sandra, thank you. Mahala, please.
Okay, I have several questions. So one is, I read that the unions got together with the city and they agreed for the us to go into this Advantage Care program. So the union usually covers our eyeglass, dental, and prescriptions. Are you going to be covering that? And also, I see a therapist. I definitely need to see my therapist. So I would like to make sure that my therapist, who actually accepts what I have now, will continue to accept it so that I continue with my therapy.
So I know you can jump in on those, Kim. I'll just follow up on the first question from Mahala quickly to say that there's nothing that's going to change about your regular welfare fund benefits.
Okay.
Our PSC Community Welfare Fund is going to continue to cover the things that it
Oh, okay.
currently does.
Okay.
So Kim, do you want to respond to the others?
Sure. I want to encourage Mahal to contact the 833 number to have the representative look the provider up or do outreach to that provider to ensure that the provider will continue to accept the plan if they're Medicare participating and they accept Medicare and the senior care plan today. I'm assuming that there should be no issue moving forward under the New York City Medicare Advantage Plus plan. I will go to the opt-out question next. The City of New York wanted to, and MLC wanted to simplify the process for retirees by instituting the opt-in, the opt-out process. If we had an opt-in, it would be very difficult to manage the members choosing the correct program. So when you receive the pre-enrollment kit from the Alliance, in that kit, there will be an opt-out form. There will also be instructions where you can opt out directly on the microsite. You can opt out telephonically. There's a whole host of ways you can opt out so that your enrollment is never sent into CMS for the New York City Medicare Advantage Plus program. So the opt-out portion actually is happening before you're ever enrolled into the program. So we're not enrolling you and then opting you out. You're letting us know that you do not want to be enrolled in the Medicare Advantage Plus program. So that's how the opt-out process works. In regards to how Medicare Advantage programs save money, it really comes down to the mechanism of how Medicare Advantage is set up. The majority of the funding for Medicare Advantage programs actually come from the federal government. So most of the cost of the plan and premium is actually coming from the federal government. And that is how the City of New York is actually saving money. And one of the ways that the program is saving money in addition to the federal funding is really making sure that members get the appropriate care and closing gaps in care. So encouraging wellness and encouraging preventive care and helping members manage their chronic conditions better to help prevent the unnecessary emergency room visits or the constant hospital readmissions back and forth, getting them coordinated with a case manager or care management nurse to help the members manage their care better. Actually, at the end of the day, results in better medical outcomes for the member, but in turn also relates to lower costs to the program because members are staying healthy and managing their conditions better. So it's really twofold. It's helping members manage their conditions better, as well as the additional funding from the federal government. So that's how the program saves money for the city.
Kim, thank you. Folks, I know there are a lot of other questions. So here we've gone 10 minutes or so over time, and we want to save a bit of time as well to have a discussion after the representatives from the Alliance leave the meeting. But I do want to just reiterate one more time that the questions that you have, if you didn't get to pose them verbally today, please do submit them through the web form that Fran Clark just posted in the chat, and of course the 833 number that's also been placed in the chat. You can ask your questions there. Kim and Marlon and Chris, I want to thank you for being with us today. It's been very instructive. As you can tell from the additional raised hands and from the liveliness in the chat, there'll be other questions for you and your colleagues coming your way. Appreciate the time you shared with us today. Thanks very much.
Thank you. I appreciate the opportunity.
And on behalf of Emblem Health, we thank you for having us today.
Yeah, thank you. Yeah, this is a, and James and obviously the entire union and trust, just as if there's anything that we can do. And if we need to do additional, Q&As, we'll also do that. So just, again, I know this is the start of a journey, but again, more importantly, we want to be able to educate and give you the most complete information that the city and the MLC made decisions on. So we want to be there for you guys, both the Emblem and the Empire team. All right.
Thanks very much.
Thank you all.
Enjoy the rest of your day, everyone. Be well. Thank you again for your time.
Stay well.
So folks, while the while the Alliance reps depart, if you'd like to stick around, we're going to have 20 minutes or so where we get to have a discussion among ourselves. And I think I would like to ask Naomi